So, welcome to tonight's Health and Wellbeing Board. I think there's probably some new people in the room, so it might be useful if we all introduce ourselves. I'm Hazel Simmons, and I'm leader of the council, and I chair this meeting. Let's go around this way, Nikki.
Good evening. So I'm Nikki Pulane. I'm the Link Director, and I'm also the Chief Primary Care Officer and the Vice.
Good evening, everyone. My name is Mark Fowler. I'm the Corporate Director for Population and Wellbeing and also the Deputy Chief Exec at Luton Council.
Hi, I'm Bassem Mahmood. I'm the Portfolio Holder for Adult Social Care.
Councillor Malik, Portfolio Holder, Public Health.
Bev Davis, I'm the Partnership and Engagement Manager for Beds Fire and Rescue Service.
Pleased to meet you.
Phil Turner, Chair of Health Watch Luton.
Welcome.
Hello, I'm Beverly McConnell. I'm the Strategic Business Manager for Luton Safeguarding Adults Board.
Thank you. Welcome. Sally.
Hello, Sally Cartwright, Director of Public Health.
Okay, and the two at the back there.
Thank you, Chair. I'm Lee Bridgen and I'm Chair of the Children's Services Review Group.
Hello, I'm Richard Underwood, Chair of the Health and Social Care Scrutiny Review Group.
And we've got Alan Caton online. Do you want to introduce yourself, Alan?
Yes, Hazel, good evening. My name is Alan Caton. I am the Independent Chair for the Luton Safeguarding Adult Board and will be presenting the annual report at the meeting.
Thank you. We may get other people come in. I've had a couple of messages saying they're running late. So welcome to this meeting of the exec. And I think before I move on any further, I'd just like to say tonight is Sally's last Health and Wellbeing Board. So I think it would be remiss of me if I didn't say thank you, Sally, for all your work you've done, not only for the Health and Wellbeing Board, but for the council as our Public Health Director. So we're sorry to see you go and we do wish you well for the future. Thank you.
Thank you. It's been my pleasure and an honour. Thank you.
Right, have we any apologies for absence?
Thank you, Chair. We've had apologies for absence from Councillor Ambier, Robin Porter, D. Raj Chibber, Anita Paisan.
Yes.
Thank you. Stephanie Simone, David Carter, Jill Britton and Michelle Bradley. Thank you.
Okay, we have no business. Disclosure of interest. Obviously, if anybody's got any disclosures of interest, if you could report them now. And
sorry, Chair, the minute.
Oh, did I miss the minutes? Oh, I'm sorry. Apparently, I've missed the minutes of the last meeting, which was the 14th of October. I'm not going to take them page by page. If anybody's got any issues they wish to raise, please do raise them now. If not, is it okay for me to sign the minutes? Yeah, thank you very much. We now move on to disclosures of interest. And if you, like I said, if you have a disclosure, please just let us know. Item 4 is urgent business, which I've not had to report any at all, no. So we move on to the items, information items, and we have 3 information items there this evening. Alan is there, the annual report. Alan, did you wish to say anything? This report is for noting by the Health and Wellbeing Board, I take it. Yeah.
It is for noting, Chair, and I just wonder if you want me to sort of give a bit of a brief overview and a bit of context into the report and leave a bit of time for questions, or if people have read the report, it's up to you, Chair, how you want to.
We normally just note these, but if you've got anything specific you'd like to raise, please do.
Well, I suppose it's a good opportunity for me to just highlight that safeguarding is everybody's responsibility and certainly mention it at this board as well. And just a reminder of people that it's all about, in the adults partnership, protecting an adult's right to live in safety free from abuse and neglect. And it's about the partnership and it's about its people and organisations working together to prevent and stop both the risks and experience of abuse and exploitation and neglect whilst at the same time making sure that the adult's well-being is promoted, including where appropriate, having regard to their views, wishes, feelings and beliefs in deciding on any action that the partners need to take in supporting that individual. We do run through the 6 key principles, and I won't go through them all in detail, but they are empowerment, prevention, proportionality, protection, partnership and accountability. But most of all, we do want to make sure across the partnership that everybody makes safeguarding personal and really puts the individual at the focus of the work that they do to provide that support and protection. I guess it's just worth noting, I'm sure everybody is aware, but every local authority must set up a safeguarding adult board. And obviously in Luton, we have our Safeguarding Adult Board, which has been established for some time. It's the duty of the Safeguarding Adult Board to assure itself that local safeguarding arrangements and partners act to help and protect adults in its area with care and support needs. And that's what it's all about. And the 3 duties of the board are to publish the plan, to conduct safeguarding adult reviews, and to publish an annual report. And that annual report is before you today. I think it's just also worth pointing out, and as I've said in my introduction, that safeguarding is becoming, or it is certainly, very challenging and complex in Luton, as it is in the rest of the country. But we've certainly seen over the past year or so the health and social care system having to cope with increases in demand. We've seen increasing volume and complexity of safeguarding issues and concerns where individuals experience severe and multiple disadvantages, which I think is something that's more and more coming to the fore now. So that will include homelessness, domestic abuse, substance abuse, mental ill health, alcohol abuse, contact with the criminal justice system, and exposure to sexual exploitation. So all of those things, and a lot of individuals we're finding are wrapped up and suffering with more of one of those complexities. So, but in a nutshell, Chair, I mean, the partnership, you'll be pleased to know, in Luton is one that does want to work very collaboratively. It is focused on seeking out our most vulnerable individuals and providing the best care and support that they possibly can. I mean, it is really noticeable for me that when you get a senior leaders around the table, often the virtual table as it is these days, everybody wants to work together and tries to understand everybody, which is a challenging time, particularly when resources and funding is in scarce supply at the moment, and we're all finding that, and all agencies are finding that. But it's good to work with a partnership that really does want to do their best to provide the best care and support that they can across that wider partnership. So, I mean, the report speaks for itself. It covers details of the safeguarding adult reviews. We've conducted a number, sadly, where adults have either sadly died or have suffered significant harm, and they have care and support needs. And there was concerns around the way agencies work together to protect and support those individuals. So when in those circumstances we have to conduct a safeguarding adult review, we've conducted a number. And we want to make sure that the learning from those reviews is embedded into practice to prevent further occurrences of either death or serious harm occurring to adults with care and support needs. So that's another aspect of the work that we do within the board. But it also talks about our audit work in that report. It talks about the sort of priorities and our achievements against the priorities. It talks about other concerns that we may have that we need to work on, and particularly when we talk around transitions and young people transitioning to adulthood, which has always been a bit of a concern. In children's services, some of these children get a good wraparound service, but actually transitioning when they reach the age of 18, they often fall off this cliff edge of service because the thresholds for adult provision and thresholds for mental health provision for those young people is often not there. But that sort of gives you a very brief sort of overview and an introduction. My thanks have to go to Bev McConnell, who I know is in the room with you, who Bev works very hard in pulling all this together. So I hope there's enough time for any questions anybody may have. But like you say, the report is something that we have to do, that has to come to you for your information. And like I say, it's a good opportunity to remind everybody that safeguarding is everybody's responsibility.
Thank you, Alan. Thank you very much. Are there any questions? None at all? Are we happy to note the report? Thank you very much. I'm sure if anybody's got any other comments they would like to make,
Yes, pass it on to myself or Bev. Yeah.
Bev, please come back at any other time. The next item is BLMK's Integrated Care Board report. Is that you, Nikki? Do you want to say anything?
No, other than that it just gives you a summary of the board meeting in public on the 27th and the further sustainability summit, which is all system and a number of people at. I think it's fairly self-explanatory.
Okay, are there any questions on that report? No, I'll be happy to note. Thank you. And the BCF Q2 report. I'm not sure who's doing that one. Did you have anything to add, Sally?
No, just it's in the paper and it's to note. So as long as everyone's happy.
Thank you. Are there any questions on that report? I'll be happy to note.
I will say,
yeah.
The only thing I just like to say is that we as Place Luton, it is recognised it's a particularly well managed better care fund, and I think it is about really having a handle, and it is recognised. So I just think it's useful to note that.
Thank you. Thank you. Okay. Those were the information items, and the next we are going to have a discussion, but I've been asked to move the Luton population wellbeing strategy first because that will help, I think, with the discussion that we've got at the end of the report. So, Sally, would you like to take the Luton population wellbeing strategy first?
Thank you, Chair, and thank you for rearranging. I think it just gives a bit more of a wide context that then leads nicely into the discussion item. So this is an update on the population wellbeing strategy. So we're 2 years into the strategy. And just as a reminder, this is our joint system health and wellbeing strategy that's owned by the Health and Wellbeing Board, which is a statutory requirement as a system delivery strategy for health and wellbeing. We agreed it at this board in 2022, and then we're 2 years into the strategy. So this is an update on progress and an update on some of the measures and the actions that we said we were going to deliver on. It also gives a bit more of it's sort of an evolving strategy as system changes and 2040 gains more momentum, how we align to the various outcome measures within 2040, and the sub-boards that deliver the strategy are sort of shifting a bit around what their priorities are. So it gives a bit more of a context around how it all fits together. So I'll just walk through a few key items that I wanted to highlight, and there was also some late data pages that I will talk to as well in a minute. So in the pack, so on page 133, there's just a bit of a refreshed diagram of how it all fits together as we deliver the strategy. So we've got the Health and Wellbeing Board, obviously that's us here, sat here, and then there's some sub-boards that deliver key priorities within the strategy. So we've got Children's Trust Board that picks up the strategic direction around education, SEND, family help and pathfinder, Start for Life including family hubs, the NEAT plans, Child Friendly Luton, and then some of the public health strategic priorities that have a children and young people's focus. So obesity, the children and young people's focus of mental health, obesity, tobacco, oral health, substance misuse and teenage pregnancy are all discussed and have strategic oversight at Children's Trust Board. And then at Health Equity Town Partnership, the strategic priorities around physical activity, tobacco, food plan, community inclusion, and the voice of the community. So that includes Talk, Listen, Change, which is in the next paper, Healthy Place, Health and All Policies, and then how we deliver strategically Health Equity Town, which again, Jim will talk to in more detail in her item, and then how we think about the social determinants working groups that are part of the Health Equity Town agenda, so housing and health, employment and health, net zero and health, and the built environment and health, so how all of those elements we can have a greater impact on health and health inequalities through working collaboratively in those areas. Place Board, where health and care and integration comes together. We've also got a new board, which is the Population Delivery Group, which is about system working on some 5 priority areas outlined there. Community Safety Partnership, so the health and wellbeing bits of the Community Safety Partnership was oversight in connection to health and wellbeing strategy, and then the infectious diseases elements sit within the Health Protection Committee as well. So it all fits together in terms of all of the priorities that we've agreed that we will deliver as part of the joint health and wellbeing strategy. So I'll just direct to another couple of pages. So page 122 in the pack just outlines where we had some discussion in a previous Health and Wellbeing Board around the 2040 measures. This is just aiming to visually show how that fits together with the measures and the delivery of this strategy. So where we've got the high level 2040 system-wide measures that we know we will look at on an annual basis as part of our delivery to 2040, they sit across the top of this strategy. And then for each of those boards, some of those measures will be owned by these boards. And then there will also be another set of measures that are owned at a high level by those boards that talk to each of those priority areas that they're working on. And then for each of those priority areas, there will be some more detailed process output progress measures. So, for example, for the physical activity strategy, there will be lots of more detailed measuring around numbers that are coming into some of the services that we're putting on, numbers of outreach sessions held, but that will be seen in those strategic boards rather than as the high level measures in this board or the sub boards. So it all starts to fit together. I'll talk to the additional data packs in a minute just to explain what that shows. But then what this paper then outlines is for each of those boards, what we said, so page 123 onwards, what we said we were going to do in the board for last year across each of those boxes priority areas, how that's progressed, and then what we're saying we're going to prioritise for 2025. So we've taken this to all of the boards and had discussions with the leads for all of those strategic areas to set that work plan for the coming year. And then what these tables also show is which 2040 measures that came to this board previously, that board will hold. So then it starts to align really nicely across the measures and the population wellbeing strategy measures as well. So all of those key work priorities for the coming year are outlined across the next tables. And then I'll just walk through very briefly the additional data in the packs that were circulated today, because the data tables in this document aren't particularly friendly on the eye, and there was a bit of an error where they don't actually show the figures, they just show the trend and the RAG rating. So there was a bit of an error when we pulled them together. So the additional papers that were circulated just show the high level measures across the boards and show progress against compared to last year and compared to region and the trend. So you'll see looking through them that there has been some good progress in some of the measures. And the ones that are in bold are the ones that are also part of our Marmot Town. So there's across the whole system, there's some Marmot Town ones that we're just going to be pulling out and looking at as part of our Health Equity Town on an annual basis. But just to note, there are some that are showing some good improvements. So proportion of children in workless households has improved. Proportion of children attending good or outstanding schools has improved. Good level of development at the end of early years has improved. I won't go through them all, but you can see some really good improvement across some of the measures, which is really positive. But obviously lots of work still to do, and some are either not shifting or have got worse. So we need to just continue the focus on those areas. But there's none in there. They all correlate to some priority work stream areas. So there's nothing in there that we're not really focusing some work on. So it will just need to continue into the next year. Thank you. I'll stop there.
Thank you, Sally. That's it.
Thank you, Sally. I think, it's welcome to see some of the improvements that we've made. And I know, putting this into context, nationally, we've seen declines in life expectancy in other parts of the country as well. But I'm just looking for some reassurance, really. I mean, when it comes to kind of life expectancy for males, significantly worse, proportion of care leavers not in education and employment, significantly worse, good level of development for children aged 2 to 2.5 years seems to have worsened as well. And it's quite worrying, especially given our 2040 vision. I'm just wondering what kind of reassurance you could give that we're moving in the right direction on those.
So, I mean, you said at the beginning that so the life expectancy, for example, as you suggested, is going down nationally as well. So we're aligned with the national trend, and there's not one thing for life expectancy, of course, that would make a difference. It's all of this work all coming together. So the prevention, the social determinants of health, as well as health and care services, all contribute to that. So, and it won't shift overnight. So I think we just need to keep pushing on all of this work that we're doing collectively as a system, really, and for those ones, and the healthy life expectancy, which is really important, because the more years of life people can live live in a healthy life state, then the more they will be able to work and contribute to society, and that's the real measure that we want to really see the improvement on. The problem is with that one, it hasn't been updated, so we can't see how we're doing compared to the last time. But what I'd really like to see is healthy life expectancy improving more than life expectancy, because that has a real impact on health inequalities, but obviously we haven't got that data. So I think we just need to continue with the system working that we're doing, and it's really good to see that some things are starting to improve. The other ones so care leavers, there's a lot of work, and it's a shame that Diraj isn't here just to talk to that in a bit more detail, but there is a lot of work around care leavers and collectively what we're all doing around care leavers in a strategic way, and it's coming through to Children's Trust Board actually this week to have some discussion on some of that. And the good level of development. So in this data sheet that I circulated late, there are still some errors, so I still need to go back round a loop on it. So I've spotted a few things as I've been looking at it today, but because of the repetition on the good level of development one, which I'm not sure why. So one of them is showing an improvement and one of them showing a worsening. So I just need to go back and check on that.
Oh? No, are you happy to agree the report then? Yes? Thank you. Sorry,
Janice is just going to substitute for Diraj.
Oh, all right. He's not speaking though, is he?
No,
No.
Janice.
No. Janice, do you want to introduce yourself? And Councillor Umi Ali has arrived as well, just so that everyone knows who you all are before we move on to the next. Yeah, sorry. Thank you. Umi?
Sorry I was late. Councillor Umi Ali, I'm the portfolio holder for Children's Services.
Okay, thank you. We now move back up to the discussion topic we've got on the agenda tonight, which is the Health Equity Town and Talk, Listen, Change. And that's over to yourself again, Sally.
Thank you. I'm going to hand over to my colleague Chimeme, who is going to take this item.
Good evening. So I'm just going to, because this is a discussion, I'm just going to quickly just run through the summary of the paper, and then we can get into a few key questions. So the purpose of this is really to update you on the work of the Talk, Listen, Change work that we've been doing, and also around the progress of the Health Equity Town work that we've been doing as well. So we've been doing Talk, Listen, Change, and I've been to this board several times, giving you an update on how from COVID, how we've been progressing. And we're now in the stage where we're coming up to our second action plan for this year and going forward. And the summary of this particular slide, which is not in the slide deck, so this is something different, demonstrates some of the range of activities that we are doing, ranging from cultural competency, trying to build our communications, which is one of our weak areas that we're going to build up on. We're doing some training and supporting frontline staff, such as social prescribers, link workers, local area coordinators, with health education, with understanding the health system and several other topics. Cultural competency is one of the key areas that we want to focus on, as well as men's health and some health literacy. And with that, we're doing some videos and some translation of services around mental health, around diabetes, and can't remember the third one. Yes, of course I can. Yeah. Apologies. It is a bit. Is that better? Does that help? And we've found we've had various impact in terms of engaging with our communities, but we realise there's still quite a lot of work to catch the engagement at an appropriate level. So what I mean by that is making sure that the right people are in the room, not just maybe some of our colleagues who are in system or frontline workers, but also people who experience COVID. So those are some of the areas of improvement. However, that being said, here are some examples of some of the case studies that we have gleaned. We have over 30 case studies of making this a reality for people out in the community and showing our system partners the difference that we're making. And key to that is capturing the case studies in a format that's easy to access, but also making sure that we share it and expand that knowledge and that expertise that's happening within the community. So here you've got examples of our Health Equity Town prize winner, which is the Youth Connect, Building Bridges for Better Community. So working with young people over the summer and beyond and ensuring that they have support around volunteering, they support around their mental health, supporting around CV writing, and just accessing services that kind of enables them to build their confidence. And then more recently, the over 50s Black Men group has come into the fore and been very strong in presenting themselves. And what they're doing is looking at mental health, and they are linked through the health equity, the Black Health Equity Steering Group that we have supported through the Talk, Listen, Change work. There are other groups that are sort of ethnic orientated, like the Muslim Medical Association group that we are going to be supporting, and of course the local the Irish Forum and the Roma Trust as well locally. Finally, just to say that, well, not finally, but just to say that we are actually, as Sally spoke about, we are trying to measure our impact as a system and our collective efforts. So what you see here is a snapshot taken from our monitoring tool, where we're looking at prevention, which is one of the 8 areas of the Marmot areas. And what you can see is that obesity rates are improving for adults, and the under 75 mortality rates around circulatory diseases are also improving. So that's just to say, as Sally alluded, through the population wellbeing strategy and links with Luton 2040, we're measuring our progress. Where we are now is we are mapping our recommendations and trying to think about, from the original report of the Health Equity Town work, where we can build on the best practice. We also want to be able to share insights and that best practice across all areas, across all 8 work streams. We do have, in terms of developing the Talk, Listen, Change, the overarching is the Health Equity Town work, and within that we have 4 key working areas, and those 4 key working areas are the housing and health, children and young people, net zero, and business, employment, skills and health. So those 4 areas have their own work streams with their own logic models, which will ultimately come up with process indicators that will feed into the slide that I showed, and that feeds into the population wellbeing strategy. We know that in terms of the Health Equity Town work, it's very vast, and it's all about bringing systems together. So this slide is showing the difference it's making. So we are collaborating with our partners, in particularly ELFT, because that is a Marmot Trust. We're leading on the social determinants, as I made mention before, the 4 key areas. We're influencing the system and the way it works through Core 20+5, through our culture of competency training. And finally, we're doing the real sort of nub of it, which I've spoke about in depth around the Talk, Listen, Change work. So those are the areas that the Health Equity Town, and that's the overarching work that we're doing now. So in terms of a discussion, I would love to be able to have a discussion around what we can do to increase our visibility and embed some of the work that we're doing around Health Equity Town and linking that up much more around the Luton 2040 pledges. We know we're doing great work around Talk, Listen, Change and other community work through the Health Equity Town Prize. How do we ensure that that voice of community still is maintained and actually fed back in a visible manner? And what is our best approach in maintaining momentum? So one of the struggles is because it's such a big work piece, keeping the momentum going is key, as well as the visibility. So ideas around that would be welcomed. And then opportunities to share best practice. And then ultimately, how do we get the biggest bang for our buck? And, you know, is it a focus down on one specific area, or do we just carry on with the four streams of working and the system working that we're doing, and ensuring that that has visibility, traction, and we're able to measure our success? So in terms of, let me stop sharing. In terms of a discussion point, I thought because we can't get around the table as such, might be good to try it and do it on Menti, and you all look on the screen because you're all sat disparately. Let me go to the next slide. Mentimeter. Yeah, let me see if I can make it a little bit big. Oh, no. I'm not sure if I know how to make it a little larger. Let me see. Can you not see it? Okay. That's no good, is it? Okay. Let me present. How's that? Okay. So can you only see some of it? Can you use your, do you have your phones? Do you have your phones? Can you do it on the phones? So if you go to mentimeter.com, on your mobile phones, and then I will, that's everybody. If you all go onto your phones, oh goodness. This was to facilitate, I understand this is new, so hopefully maybe next time we'll just do paper and sticky notes, but if we just try to go to Mentimeter, and then the code is 7805. Okay. I'm hoping that you've all used this before in workshops and things, yeah? The internet's poor. Okay. Should I just do it on PowerPoint, and then would it be easier? So, because I can just, you could always just talk back and I could write it. 78052035. How are we doing? Yeah. Okay, we've got one response. So because Health Equity Town is such a big piece, it is a way of working rather than a program of work. It's got work and programs under it. Talk, Listen, Change is one of those programs. What I'd like to be able to sort of be clear on, or get your feedback on and your thoughts on, is Luton 2040 is our absolute vision, but how do we embed it and ensure that we are still the pledges reflect back and utilise the Health Equity Town work? How do we sort of gain synergy with those two pieces. So Health Equity Town is a way of achieving Luton 2040. So we could link into core service design and delivery. Anything else that anybody wants to add? And you can shout them out because I can always write them down. Everybody okay? Is it too awkward? Okay. Shout out to me as well then if it's taking too long. So we've got things like pledges need to be challenged. So the pledges need to be challenged on progress with contributor. The pledges are already aligned with Luton 2040. It's more about making sure the pledges are actioned. Ask specific question about how partners tackle inequalities or flex approaches for different groups. Yeah, thank you. Have we exhausted that one?
There's anybody that's, I'm going to just co-facilitate for a sec. Is anybody that's not written anything because they can't access it or can't able to? Does anybody want to say anything?
Please do shout out because I can write it. So we've got, do we think about how the pledges link to each other? How can different system partners be measured on performance against pledges? Yeah, I think certainly Luton 2040 team are thinking about that, but I think we need to make that more explicit to those who are making pledges that we are a health equity town, and the whole point is to improve equity and reduce health inequalities. Ensure what is said is done. Yeah. Okay, I'm going to move us along because I'm conscious of time. So I talked about talk, listen, change, but there are other things that we're doing. For example, Core 20+5 enables us to do more work around communities and making sure community voices are heard. We've got our cancer connectors, we have other connectors, we have link workers, we've got local area coordinators. All of these people are working with communities to improve their health and their quality of life. How can we ensure that that community voice continues to be heard and to be amplified and acted on? Ensure we all feel like we can play a part. What do we mean by that?
So when it's about community voice, sometimes I think people sit on the side and wait for others to think it's their responsibility to do that. So it's actually a whole system thing that we all have different connections with different communities in a different way. So how are we bringing those things together?
Yeah. Anything else around community voice? Are you okay over there, Health Watch?
I tell you what, I'll talk because I'm not doing it.
Yes.
Yeah. So I just say to you is that hopefully everybody's aware of this thing that's called the Action Learning Set, and it's something we're working with the Institute of Quality Improvement. So in Luton, we've got two cohorts of people. So we've got one cohort of people where we've identified through the data that they don't come forward to be identified as having high blood pressure. And then we've got another cohort of people that they know they have high blood pressure, but they don't seem to, for whatever reason, manage it. And there may be a whole raft of reasons. So it is working with our populations to find out why, not second guessing. But I can truly say I've sat in a few of those meetings and I'm mesmerised how we, the anchor institutions, don't network together to make it seamless for our residents. We assume that people can just recognise it, you know. So in just to give you an illustration, in one particular, we had some residents, we've got some remuneration for them, recognising their time, etc. But for example, people don't live in silos. So hypertension tends to be a familial thing. So you start recognising it to your friends and family, and in the pack there is something about some of those community things. So we definitely utilise that, and it's utilise the learning from it because it's all about the voice of the residents.
Yeah. So one of the things, the projects you're talking about, the land, is Indians specifically and Black African, Black Caribbean people. And one of the ways that we've tried to do that is use these groups of people where they sit. So we've got the Health Equity Black Steering Group, and we've gone to them to try and get people represented. And I know that into the Gurdwara and other places to try and get, but it's making sure that those people they have they feel like their voice is valued, and going back to them. And it's something that's been challenged to us in Talk, Listen, Change, making sure that you feed back and always feeding back to them so that they know that they're being heard. Somebody in a meeting said that they felt like they were being pimped, that they were always being asked for their opinions, but never an opportunity to hear. So very, very, very conscious of that work.
I was just thinking about an example where we have done not the feedback loop to the community, but the feedback into the services. So the cancer connectors who talk to the community a lot about the struggles that they have with access to services, or why they were diagnosed late, or why they missed an appointment, that kind of community voice element. But then I think, Jim, you facilitated it, but there was a session with GPs to feed back that learning to the GPs so they could hear, oh, actually, that isn't right in the way I tried to deliver that, or I should be texting more, or whatever it might be. So then there was that feeding it back into the system to drive change. So I think that's a really good example of when the change bit has happened and it has fed in. But for all of the bits of consultation work that we do or community voice, there's not necessarily that forum to say, this is what we heard, now what are we going to do about it? So I think making sure that is structured at the beginning to think about how we're going to do that, what difference is it going to make, piece. But then I don't know if for that, just thinking through that process around, for that piece of work, have we then fed back to the community that the cancer connectors were talking to say, this is what we've done with your insight?
Actually, we haven't.
Yeah.
Not formally.
So.
Can I ask then? So we've got lots of stuff that we're doing in terms of like the local area coordinators and the other stuff. Do we measure the effect of them? So do we have anything that's measuring, for example, because we put this in place, the number of this has gone up, or this has gone? Obviously, some of the stuff like life expectancy we won't see for a very, very long time. Are we doing that?
Yeah, so in some projects we do it really well, and in others we don't. So some of the TLC projects we've done it quite well, and some of them we haven't. But we also capture, because it's not so easy to always capture that quantitative data. So that's why we try to build in the case studies and make it so that we capture people's, like, the difference it's made. So it's a bit of both. With the work of the Core 20+5, we're actually looking to sort of be a bit more purposeful around the impact that's making and the difference. But the real impact, because we're talking to people, is how they felt about it. So we capture it, so it's a bit of a mixed picture.
And sometimes that pool of people is very small compared to the population of, and like, for example, with the Talk, Listen, Change webinars that you're doing, what sort of response has that had? Has that had like a lot of uptake, or are we like, it sounds like a really, really good thing, but has that got the uptake that we wanted?
Right, so we didn't set a baseline, but we have had uptake. As I said, it's been a mixed picture. I think Councillor Malik wants to respond to that, but I'll respond afterwards.
I think there was a big, I think that was one of the pieces of work that it's not about, when you're talking about the numbers and the people, this was a research done by the university, and they got to, because you're going to have the same people that always respond to any type of research or communication that we have. And they're the heard voices of the communities, of any community, all communities that are vocal about what they want to say about it. And those people are always there, you know, to respond back to something that's happening. They're not the voices that we want. They are some of the voices we want to hear, but not all of the voices. There's the people that don't normally come forward. And in the talk, listen and change, we were able to speak to people that we would never get to. And I won't say they're hard to reach. They're always there. We just never are able to get to them. And this research really showed that we were able to get to those communities that we targeted. We specifically said that we were going to be doing this talk, listen and change on, because it was based on COVID and the impact it had on particular communities. So those communities we wanted to get to, we were able to go and reach out to. So when I'm looking at how do we ensure community voices continue to be heard, it's about the work that we do. So if we've got work like the Cancer Connectors are doing, I would like to see what impacts have we had and how is that going to change somebody else's life. So if we've identified that a family wasn't able to, for example, get treatment or wasn't able to access something because it was further away, what change is that going to make to another family that will be able to access that now? It's not about doing the research and writing it up, and the connectors have done this. And I think I've challenged that. I don't care about that. That person has now passed away, because I know of families that they've worked with. Well, it's no good to them, the Cancer Connectors, and writing up a piece of research and they've been with the family. Well, you didn't make a change. I know of families that I've spoken to where they've had Cancer Connectors that have been with them, but the change wasn't made. They were promised research. They were told that they would get X, Y, and Z trialed on them, and it never happened for whatever reason. But why were you there supporting them? What did you support them on? How is that going to change another family that wants to access that same thing that that family wasn't able to do? And what difference is it that we're going to be making? These fancy names to me is nothing. You know, having the connectors here, we've got all types of connectors everywhere. How do we really make sure that those voice of communities is heard and are able to make those changes? So for me, I think I have challenged them enough in terms of that. So even here today, sitting here, I'm thinking, all right, I know that I'm vocal, or I know that I'm able to go and say this, why is this going wrong? It's that person that's going to sit there thinking, is this the right question? Shall I ask this? Oh, you know, no, forget it. You know what? They're not going to really listen to me. I don't really care. I'm not going to, it's my change isn't going to make that difference. We need to prove to the community we are listening to you. And part of this talk, listen and change is we did listen to you. This is what we've done. This is what we're going to do. This is how we continue to do that. So it's not hard to reach. It's those voices that seem to think that, you know what, they've always asked this research. We've always been part of this. What change have I seen? Haven't really. Do you know what? Forget it. I'm not going to really do that. So my challenge is always around those people's whose voices that seem to be missed. And it's about, when we do a piece of work, we need to make sure that it's measured around the communities that are affected. Because if we've got a population of a community, well, if you've got, you know, we've got to have an average amount of people that respond to a piece of work that we're doing to say that it's valid. Because if we're not going to get responses, there's something we've done wrong in terms of engaging with communities.
So we should be linking the voice and feedback into doing, encouraging people to do more, utilize social media. Can we do more in how we approach genuine lived experience, which is what Councillor Malik's talking about? And I will say this, that we have gone out to those communities, but we know that there's more to do. We actually have conducted and used those communities and worked with those communities, you know, use their spaces to do work with them. The challenge is making sure that it's broad and deep and consistent. So we recognise that with the talk, listen, change work. I think this is the second to last, penultimate one. What is the best approach for maintaining momentum when the end goal is difficult to see in the long term? Any thoughts on maintaining momentum, thinking about it in terms of Health Equity Town as well? Everybody here will have inequalities or health inequalities, thinking about that disparity. How can we capture and maintain it? Some of the things that we're trying to do, and, you know, yes, TLC is a community voice, but some of the system work we're trying to do is create a common way of working through a toolkit. So thinking about anchor organisations and supporting them to think about inequalities. Advertise small wins, yeah. If you can, whoever's written that, if they can say where they think that it should be advertised as well. That's my question.
So we just came from Place Board a little while before this, and I was sharing the population wellbeing strategy updates, but focusing on the Place Board elements. And we were saying where there has been progress on some of the measures, how do we share that wider than this high level strategic forums and take some of the positivity out to either people that are working on the ground and need to know kind of that they're part of the bigger picture, or even the community. So it was a question that Nikki and I both thought actually it would be helpful to maybe pull out as we're discussing it here. Is there something, so, you know, the paper that I showed on some of the data, it's a bit data heavy, but is there some way of getting out to the community with some of that, or within services for people that are working as part of, we want them to be part of the journey with us, don't we?
Yeah.
So how do we do that in a more accessible way?
Okay, so we've got things like small steps together create big leaps forward. That's encouraging, thank you. Really make sure communities can see the change, yeah. And that's what are definitely going forward in the new year, that's what we're going to be doing, focusing on making sure we go to the right people and speaking in their language, and I mean sort of generic term language, and making sure that they know that we have listened and we have put things on and they have come to them, not all of them, but we have done things for them, and sharing some of those case studies like I spoke about earlier. I think this is my last one. Thank you. I think it's very similar. What opportunities are there to share and learn from good practice? So this was a question, actually, Councillor Malik, this was your question. We were thinking about it broader. So not just thinking about it in terms of sharing good practice in Luton, but across BLMK, what would be the best way of demonstrating some of the things that we have done, especially around being an Imamate town and the approach that we take? Ask me more questions and then I can help you think about that particular question. It's quite a tough one. I think what we're asking is how we share and learn from good practice, but wider than just Luton people, the residents of Luton. We're talking about within our system partners and across BLMK. So across the health and social and the care system. How do we share the good work that we've done already?
I'll put my mic on.
Yeah, thank you.
I think a lot of what we've been saying is about the comms around it. So those small wins, those indicators where we've seen that we're significantly improving or things are getting better, making sure that the community knows that, and it's part of showing them that we are making progress and that it's one more step forward to 2040. I think that's the hard bit, because with our comms and promoting the good stuff that we do, I don't think we're the best at doing that council-wide for anything. And I think that's something that really needs working on, because I think the negativity that comes with the fact that a lot of residents think that nothing's ever happening and people die early here and the conditions are awful and blah, blah, blah. They don't know the good things that are working. They don't know about the local area coordinators and stuff like that. So I think we really need to work on how we communicate it better, rather than, I know we have a newsletter, but how many people that we're not reaching, that the people that we want to reach aren't reading those newsletters, and maybe we need to think of a different way to do comms and stuff. I think that can help with motivation as well. I think when you hear about the good things that are happening, it can make people feel better about where they are. So I find that if I know that this is really improving, and when I tell other people that this is what's happening and this is improving, it makes people have a better view of the town. And I think that can also help with some of the indicators about whether people feel happy about where they live and stuff like that.
I mean, one of the things that we've done, I just talk to that point, if I may. One of the things that we've done is that the collaboration fund, we worked with Bedfordshire and Luton Community Foundation Social Justice Unit, and it was public. We basically led and said we want to make sure that communities, the community groups that are out there, community-led groups and organisations that are out there recover and are doing something that improves health and well-being, and that disparity doesn't, try and tackle that. A big proportion of our work that we did there were in areas where the TLC groups were, for example. So they were in the Viscots and the Saints and in areas like that. Now we haven't talked about it and said, these are the beneficiaries, but there was several thousand beneficiaries that came out of that, just giving that fund out and supporting them very, very clearly. It was around COVID recovery. Another example is making sure that when we've done it through the core 20+5 work, that ultimately will demonstrate, because that is about tackling health inequalities, not COVID, not TLC, but the social determinants, and working with communities and making sure that communities hear about it, and are the people that work in the communities are out there doing the work. So there is, I think what we lack is that ability to frame it, as well as the social media and getting out there, framing it so that people catch it and know that the people in your area, in your road, community-led organisations are already doing this work, and actually it's come from public health and we've helped do it. So we've kind of been a bit of a silent partner.
The opportunities are actually in platforms like we're here now, Health and Wellbeing Board, the LMK level, sharing with other partners to see work that they're doing and to build on the work that we have done. It's really showcasing that work at that level to say this has been good in Luton. Is there something that they've gone in? And I think we've done some amazing work around some of the stuff, but it's not sold out there in terms of, we're not telling the story around how we've been able to do that. And I think we've done some amazing work around getting out to communities that we've not heard from ever. It was through people that were sat back there, somebody who we got through the school. It was a lady, and I remember one of the research that she actually said that she would never have done it is because the school had told them that we were doing something, and they just said, I've never done any of this before. So we were able to get to those sort of people. So I think it's about being in platforms here where we've got different partners that are able to really hear about what is being done and really be part of that improvement journey as we go along. So I think today's an example of what we are able to do and be.
I've got loads. Thank you very much. I think.
One comment I was going to say, the stuff that the Biscot Peace and Wellbeing Hub is doing is really, really good. And they're definitely reaching communities that we'd never reached before. So if we're thinking about like where we've learned and what we can do more, we definitely need more of that. But I wonder if we need to think, so in the NHS, they have this thing, I forgot what it's called, but it's like making every consultation count.
Every contact count, yeah.
That's it. And then they ask about smoking and stuff like that. I don't know how much of that happens anymore, but I wonder if there needs to be a bit of, like, this is really, really wide and probably not achievable, but making that, like, everyone that's committed to 2040, making that an action, because we know those health inequalities are like a massive problem for Luton and our life expectancy, and making it so if someone's come to a council to ask about housing, there's a leaflet there that says, do you want to talk about smoking, exercise, stuff like that. Making sure that if someone goes to Citizens Advice Bureau, the same thing is there.
Yeah.
The schools, getting them to send out like regular, because I think the schools are one area where, like, especially in my ward, the primary school is what helps us get loads of stuff out and get parents to events and stuff like that. So making teachers have those discussions, or doing the parent mail and talking about, this is, smoking cessation, this is what we're offering. I think it's maybe we do need to make every contact count, and maybe we can come up with a strategy where we get all of our partners to agree, even the police, like everyone, to agree that even though this might not be completely related to you at all, if we can talk about exercise or they don't have to talk about it, but a leaflet where they know they can go to for support for that sort of thing. It feels like a big thing, but maybe we could work towards doing that.
So I think that's great. We do some of that, but not as wide as you have just kind of articulated. So I think we can definitely think about that more. So we, Total Wellbeing, who are a provider for our lifestyle services, do MEC training for like CAB and various people. I don't think they've done it for the police, and I don't think we've ever really articulated, right, and now you need to do it in every single, and follow up and follow up and follow up. So I think we could go bigger on it, definitely.
Be like if we made something that was a directory for these 4 or 5 problems that are in the UK, and it's just a sheet, and then every organisation we work with has a responsibility and a commitment to passing that out and just doing that more widely. Because I know Total Wellbeing do a lot of stuff, and we can basically put that there.
There's an online thing called MEC Link that is a tool to work with it. So, but definitely, I think it's really great.
Yeah, I was just going to touch on this in relation to young people, essentially. So yesterday I had the absolute kind of honour and pleasure of being at the schools conference, youth council conference yesterday, and actually we've got some absolute rising stars and amazing young people in this town that are able to articulate exactly what their views are. And actually we heard from several primary schools yesterday morning, secondary schools in the afternoon, and young people really very clearly in workshops articulating the impact of several things on them about the town in general. But all of the health issues that we're talking about, from my perspective, any family with a child, these are going to impact on that child within that household, young carers, etc., but children that are actually living with parents that have got health issues and those needs, whether it be physical or mental health. So I think actually talking through our children, because actually they're impacted by all of this on a daily basis, actually is really very powerful. And actually the youth councils and obviously the youth council from the youth partnership as well, but all the school councils, what a platform yesterday. And Hazel, you were there, so you saw firsthand
session with the primary schools. Absolutely amazing. Absolutely amazing. Fantastic. Sorry, Mark. Sorry.
Really quickly, just building on a couple of the points in the room. Firstly, from what Janice is saying there, when we talk about engagement, actually that is a wealth of opportunity. You've just spoken about that group of people who are 2040. Really, if we think about it in that context, it's so important from that side. Umi, I couldn't agree with you more. I think it has to be part of everything we do, and we have to be relentless with it. And as part of the change work, the transformation, it has to be everywhere. And wherever we see those opportunities, connections, doing that, our partners, neighbourhood working, wherever we want to do it, but we've got to make it simple and digestible in a way that people can do something with it as well. I think sometimes we go leaflets, we go internet, we go online, everyone's overwhelmed, but actually there's just some key messages, and making that part of people's core work I think is really important. So just touching on those 2 points, because I think they are quite fundamental in the momentum we need when we're talking about here. And finally, without putting Chim on the spot too much, I suppose it's interesting, a lot of information that's come out today is about how we bring that back through the group, we update, and maybe if we think about that and provide just a bit of an update, that'd be helpful as well. But I didn't know if you had any thoughts, because a lot of good things have been said and shared, and coordination.
I'm going to collate these so I can come back again. I feel like at some point I'll have to come back anyway for Talk, Listen, Change, because you've asked for a report anyway, so I can always pull that together. So I'm happy to do that whenever you call me to come.
I was just going to say, it was when you were saying about young people. So on the 15th of November, where we had the System Sustainability Summit, it was those young people, and they were so powerful. They were just so powerful. And I think the really key important thing on that occasion, it was clearly they were worried about the environment and their future. So we have to be really clear about the purpose. Otherwise, it's all a bit aimless. So, and I think that again gets, you need to have different wording and different messaging for different cohorts. So it really is that framing and getting that bit right.
It was definitely safety.
It was, yeah, definitely. That was one of the key things.
Safety came out from the young people yesterday. Safety. Yeah.
The other thing that they did do very clearly yesterday, though, was articulate that actually this is our future. And actually that message came across very, very loud and clear. You know, actually, we're the future. And actually what we're talking about here in Luton, and actually the things we like, the things we're worried about, all of those factors that are affecting us, we need people to do things, you know, something about those things now. So, yeah. And they will hold us to account as well.
Yes, Sally. And yeah, I'll bring you in the end. Yeah, Sally.
It's all been really great discussions. I was just going to add one more thing around next steps. So obviously there's an annual public health report. That's the report that this Director of Public Health has to do on an annual basis of the statutory role. And I've set mine in motion, but obviously it will be picked up after I've gone. But because some places they'll just do a different topic and a deep dive into a different topic, but I'm being quite keen to keep the thread of this work through that, so we can sort of build on the momentum and the improvements. So we've started the framework for what that will look like. It will come through to this board in the spring, I think. And some of the data that we've looked at, but looking at the inequalities within that, will be in there. But also some case studies and some of the smaller wins that we know are starting to build up. Some of this will be showcased in there. And I was just thinking, Shim, for you, because I know you'll be working on some of the work plans within that. Some of the conversations that we've had today should be in there around setting our plan going forward for some of this work as well. So that's just a way in which we can wrap some of this up, I think, as well.
It's going to respond, yeah, in terms of the young youth actually knowing what they want to do, and you're mentioning safety, and you know, realistically, what is it that we were going to be able to do to make those changes? Yet again, we've got young people that know exactly what they would expect from us to have those changes, and we have to be realistic around what is it that we are able to do and do for them, because it's what they want, it's their future, you know, and it's about that realistic change that we can actually have without the finances, without everything else that we have. Because it's okay, again, on the comment around we need to make everybody telling us about this and it's got to be here. Realistically, if I've only got an hour to do something or 10 minutes to be with someone, I can't really be telling them about to stop smoking, pregnancy, anything else and everything else that everybody else wants me to put onto that. You know, it's about being realistic around the time and the budgets that we have. You know, I'm going to be worried about what I've got to get to them around my work and that. And I'll have to cut off that bottom bit that I've got to feed back on somebody else's, as you would see, you know, this is somebody else's, it's the police or it's so and so. But it's around how do we actually then get people to really think that actually, no, this is part of me as well. Because we have to be realistic around budgets. We have to be realistic about our jobs and what pressures we have around what else we have to do. You know, some people may be doing two people's jobs now because, you know, that post is gone. So it's reality around what we really want, expectations.
We've kind of come to the end of that session now. Thank you very much. Thank you. Really useful. I'm sorry I couldn't use the technology. We are now, I believe, at the end of the agenda, and we have an item for approval, which is the Health and Wellbeing Draft Work Plan. Is everybody okay with that, or do you want to change it? By all means, we can look at that. Is everybody okay with us going forward with that? Okay, thank you very much. I think that that's the end of the meeting. Thank you very much for your attendance. And may I